Hello there, welcome once again to the fourth med course. In this lecture, we'll be discussing abnormal uterine bleeding, which mainly aims at exposing us to some of the very important causes of uterine bleeding in women. To start with is a picture of the hormonal changes, the normal cycle of a female. Abnormal uterine bleeding can be defined as any menstrual bleeding from the uterus that is abnormal either in volume, in regularity, or timing, and that is non-menstrual. The normal menstrual cycle is between 21 to 35 days with 7 or less days of bleeding. Anything outside of this normal range will be termed as abnormal too. As a foundation, we'll be talking briefly on some important definitions, defining some important terminologies. Amenorrhea is the absence of menstrual flow for greater than 6 months or 3 menstrual cycles in a woman. Oligomenorrhea is episodes of menstrual bleeding occurring at intervals of greater than 35 days, that is higher than the normal upper limit of a normal menstrual cycle, but less than 90 days. Polymenorrhea refers to episode of menstrual bleeding occurring at intervals of less than 21 days, that is less than the lower limit for the normal menstrual cycle. Hypermenorrhea is excessive uterine bleeding occurring with regular menstrual duration. Metrorrhagia is the bleeding occurring irregularly between menstrual cycles. Menorrhagia is excessive bleeding at the time of menstrual bleeding, either in terms of the number of days, greater than 8 days, that is 8 days or more, or amount of blood that is greater than 80 ml, or the presence of both. Hypomenorrhea is the decrease in the amount of menstrual flow that is less than 20 ml of flow, which is also often associated with a decrease in the duration that is less than 2 days of flow. Postmenopausal bleeding is another important terminology too, which means that a bleeding which occurs after 1 year of the normal cessation of menses, that is bleeding occurring in a menopausal woman after 1 year of attaining menopause. Heavy menstrual bleeding, which is a new terminology of discussing bleeding, is defined as excessive menstrual bleeding which leads to interference with the physical, emotional, social, and material quality of the life of a woman, and which can occur alone or in combination with other symptoms. Light menstrual bleeding is the opposite of heavy menstrual bleeding. And another concept is heavy prolonged bleeding, where there is excessive bleeding for a very long duration. Precocious menstruation is menstruation which starts before 9 years of age. This table shows some descriptive terms for abnormalities of bleeding. This is an illustration of some of the most important causes of abnormal uterine bleeding, and the mnemonic is PAM and COIN. PAM, P standing for polyp, adenomyosis, leiomyoma, and malignancy. While for the COIN, C stands for coagulopathy, ovulatory dysfunction, endometrial dysfunction, iatrogenic causes, and the N are the non-yet classified causes. An important thing to note here is that the PAM, that is the first 4, are causes which have to do with structural abnormalities, while the second four, the COI, has to do with functional abnormalities. And the last one, the N, has to do with the unclassified uterine bleeding. Sometimes unclassified uterine bleeding is given the name dysfunctional uterine bleeding. This shows a picture of a polyp